KHTS. Hey, make sure you go to hometownstation.com for all the latest and greatest Santa Clarita has to offer. And speaking of the greatest Santa Clarita has to offer, I have a very special guest in studio, Dr. Megan LeCornu. She is the greatest orthodontist in the history of the world. I don't know
love
if
your
that's...
optimism.
But I wanted to ask you a little bit. Well, let's start with this. How do people find out more about Gilbertson and LeCornu?
Yeah, so basically we have a website, www.embraceyoursmiles.
Embrace Your Smiles.
So that's pretty easy to remember.
.com is the place to go there. You guys are located on Lyons Avenue near Wayman.
Exactly. Yep. So we're really close to the 5 freeway, so very convenient.
Nice.
And we're right here in town, very close to you guys. So yeah, it's great.
So one thing about dental care in general, I feel like the happiest place to be is orthodontic care.
I agree.
Is that
100%.
Right?
That's why I became an orthodontist.
Right. My wife had dabbled in that because she always, when she got braces in high school, she was like, you know what? Like everybody's happy at the orthodontist. Like there's pain and stuff, but the end result, everybody leaves happy.
Yeah, I mean, I spend my life making people smile pretty. It doesn't get any better than that.
That's nice.
And everyone who gets their braces off, they're always so excited.
Yeah.
And you know what? I have yet to have one patient say that they wouldn't do it again.
See?
Everyone said it was completely worth it. So it's an awesome thing.
Yeah. So I got we're gonna get into the age ages of getting braces and things. I'm one of those late bloomers. I had, if you look at my wedding photos, I have braces in my wedding photos.
Really?
That's true.
Yep. We have a lot of adults going through
Yeah.
care now. And I think it's just also the awareness, understanding how beneficial having your bite fitting together properly
Yeah.
and things aligned, how beneficial it is for your overall oral health.
Yeah.
And so nowadays there's better options in terms of getting orthodontic treatment. It's not all metal braces now. So I think it's taking down the barrier for a lot of adults, and they are moving forward with orthodontic treatment to get everything fitting together properly and to get the smile that they want.
Yeah. Okay. So let's start with that. What is the right age to get your child? We'll get to the adults later, but what is the right for your child to see an orthodontist? How young is too young for orthodontic care? Because I don't know. I feel like maybe as soon as they get teeth, you should start worrying about it, right? I don't know.
Yeah, so the American Association of Orthodontics recommends that children should be seen by an orthodontist by the age of 7 years old.
7?
Yep. And the reason why is because at that time there's some teeth coming into the mouth, and sometimes those teeth can go off track.
Oh,
So
okay.
really the orthodontist is looking at patients at that age to see if they need to do anything to prevent things from going wrong. And so it's really more of a preventative thing at that time.
Is there what sort of things can orthodontists do
Yeah.
to make sure that, maybe you don't need braces?
Things
at
are going
that
on
time?
track.
Yeah.
So things like, for example, if a tooth is going off track, it's as simple as wiggling a baby tooth out a little bit early.
Okay.
That can cause that tooth to go back where it needs to. It takes the path of least resistance.
Okay.
So that can be very, very helpful for some kids who are, potentially developing a single tooth crossbite or something like that. Another thing is our canines, they're the most common teeth to get impacted. And so sometimes wiggling out a baby canine early can prevent that from happening, which then prevents the need for surgical intervention and things like that in the future. So that's really beneficial as well.
So do teeth, when adult teeth come in, they want to be straight when they come in?
They do. They want to come in the right spot, but usually there's some kind of issue, like maybe too much crowding,
Okay.
or even things like if the patient's jaws are not fitting together properly, if the upper jaw is too small for the bottom jaw, that can cause the teeth to come in a crossbite, which can also cause a little bit of crowding and things like that. So, before the age of 7, or around the age of 7, we like to screen for those things.
Okay.
Things like crossbites, we actually like to try to correct that before the age of 10 if possible. And that's because the upper jaw is most easily adaptable before the age of 10.
Okay.
So that's why we like to see them early. Our treatment philosophy is the best treatment we can do is the least amount of treatment to get patients to an ideal result. So ideally, we want to not do any treatment until all the permanent teeth are in. But sometimes we do have to intervene, and it can help prevent things like, jaw surgery in the future. It can help prevent impacted teeth. So that is why we do like to screen at an early age.
And so what are some of the things, you notice a problem, you notice something not happening, what are some of the things that you do for those younger kids from the ages, 6 to 10?
Yeah, so around 7, 8 years old, if we do see like a crossbite developing, we usually like to do an expander. And what the expander does is it basically just makes the upper jaw bigger so that it fits properly with the bottom jaw. When we do that, we eliminate things like asymmetries from developing. We eliminate premature wear on the teeth. There's a lot of benefits that can do. In more severe situations, let's say someone comes in with like an underbite.
Okay.
Underbites are something we really want to correct early if possible.
Yeah.
Someone comes in with an underbite, it may mean that we need an expander and some braces on, and sometimes we might need some kind of headgear so that we can help correct the crossbite. But if it's not too severe and it's something that we can wait on, then ideally our goal is to wait until all those permanent teeth are in. So,
okay.
Yeah.
And again, we're speaking with Dr. Megan LeCornu from Gilbertson and LeCornu. You can go to embraceyoursmiles.com to learn more, or keep listening because we're going to continue to talk about it. Is there? Let's get to this. People's pocketbooks.
Yep.
How much money do you think you could save if you do this preventative stuff?
Well, if it's a patient with an underbite, for example, and there's someone who might need a jaw surgery if it's not corrected early. So ideally, we do want to see those patients before the age of 10 because we can modify the growth of the upper jaw at that point. If we prevent the need for a jaw surgery, patients can save $30,000 to $45,000. So it's actually a really, really beneficial thing, not to mention the negative side effects associated with surgery. When we do jaw surgery, which we actually do a lot of in our practice, adults that, maybe weren't seen when they were younger or things like that. When we do jaw surgery, it is a pretty big surgery. So it's something that those patients usually need a 6-week recovery.
Yeah.
They're usually eating blended foods. So if we can avoid that in our patients, that's our goal.
Yeah. Let's shift gears then. And what is there anybody that's too old for braces or to fix their smile?
Not at all. Actually, as I mentioned, more and more adults are seeking treatment. And I think it's because the advances of different appliances such as clear aligners. Invisalign is a very popular clear aligner brand. Also, lingual braces. We do lingual braces in our office.
What is that?
That's braces behind the teeth.
Oh.
And so a lot of patients who don't feel like they'll be very compliant with Invisalign, they opt for lingual braces and they're glued on there. They don't have to think about them and they're straightening their teeth. And nobody knows they're going through treatment. My oldest patient ever was 84 years old.
Really?
Yeah, and it's a great story. When he was completed with his treatment, I asked him, knowing everything you know now, would you do it again? And he said, absolutely. And I said, what would you change? He said, the only thing I wish I would have done different is I wish I would have done it 20 years ago. Yeah. And I said to him, what was it about your 60s? He goes, the 60s are the best years of your life. So my point of that is, it's never too late.
Gotcha.
We can move the teeth at any age. All the biological mechanisms are there. And so sometimes if we have something going on, let's say there's periodontal disease or things like that, we need to make sure that's taken care of and stabilized before we start treatment. And sometimes we have to monitor treatment a little bit more closely, but we can still get everything in the right spot. And usually it can actually improve the health of the teeth.
Fantastic.
So, yeah.
Last question here. What if you don't have straight teeth, if you don't get orthodontic care, what are some of the health risks involved other than your teeth rotting?
Yep, that's a great question. So only 3 millimeters of crowding is considered a risk factor for periodontal disease. And so when we have severe crowding, we have more plaque buildup, more calculus buildup. So it's actually better for the health of the gums and the bone underneath that when teeth are aligned properly. The other thing is if the bite and the teeth are not fitting together properly, your risk for premature wear on the teeth is much higher. And even if teeth are hitting in a way they're not designed to, that can lead to things as severe as fracturing a tooth. And then if you fracture a tooth and that fracture goes through the root, you could lose that tooth.
Bad news bears.
So it really is important for the overall health of the teeth. Think of it as like a preventative thing, If you get things fitting together and you're maintaining it, your teeth are going to last you a lot longer than if you just kind of are banging them up when they're in the wrong spot. I like to give the analogy, the teeth, they're like gears, the gears of a car. And if the gears fit together nicely, they function, they do what they need to do. But when the gears start grinding in a way they're not designed to, that's when we start breaking things down, and before you know it, you got to take your car to the auto shop for some pretty expensive repairs. Yep. So our goal is to prevent those expensive repairs by getting things fitting together properly.
Awesome. Go to embraceyoursmiles.com. Gilbertson and LeCornu. Doc, thanks for stopping by. Appreciate
You're welcome.
You.
Thank you for having
you
me.
Being here. We're going to take a quick break. More after this.
KHTS, your hometown station.